Breast cancer starts when cells in the breast begin to grow out of control. These cells usually form a tumor that can often be seen on an X-ray or felt as a lump.
Usually at puberty and in the teen age, the breast is fast growing and it's like it forms swellings in it. And many times these swellings are not cancer, they disappear on their own. And the commonest swellings that appear in the young woman's breast are fibroadenomas that contain milk glands and some fats, and of course fibrous tissue. These usually go away by themselves. But as the breast grows, there's a point where it stops making new milk glands. And at that point, any swelling that comes in the breast, that grows in the breast, is likely to be a breast cancer swelling.
Breast cancer can start from different parts of the breast and spread to other parts of the body since the cells keep multiplying. The causes of breast cancer are not specific. Medics, however, point to some risk factors like obesity, smoking, drinking alcohol, and family background.
The strongest risk factor for breast cancer is family history. And 5 to 10% of all breast cancers are hereditary. The risk is inherited. There's a gene that we call the BRAC gene that is a risk factor for breast cancer. That when somebody has this gene, then their breast cells are likely to turn into breast cancer cells.
The signs and symptoms of breast cancer include discovery of a lump in the breasts, discharge from the nipples, change in the size of the breasts, pain in the breast that is not as a result of menstrual periods, among many others. Although this cancer is common in women, there are also chances of men suffering from it.
1% of patients being treated for breast cancer worldwide are men. And at any single time at Uganda Cancer Institute, we have a man we are treating for breast cancer. So men also suffer from breast cancer because, and you talked about the breasts, because men also have the breasts. The only thing is that our breast is very small, it doesn't do the function of the breast, and so the risk is less because we have few breast cells. We don't have estrogen, the hormone that increases the risk for breast cells to turn into breast cancer cells, and so our risk is much less.
Dr. Noleb Mugisha refutes claims that when a man sucks a woman's breasts, the risk of getting breast cancer is reduced. So how is breast cancer detected?
Examine yourself. If you find a swelling, bring it to the hospital. The medical worker will confirm the swelling is there. Go ahead and do the necessary tests, ultrasound scan, take off a biopsy, take the biopsy to a pathologist. Pathologist will examine the cells and say these cells are actually cancer cells, and they are breast cells, but they are cancer cells, and therefore this is breast cancer.
Unfortunately, programs targeting early detection and treatment of cancer are virtually non-existent due to insufficient funding, and attention yet is the only viable solution.
Well, the main method of treating breast cancer is surgery. So we want to catch breast cancer when it's still at a stage where it can be operated. But when we operate it, we still go ahead and give chemotherapy. And chemotherapy, we give it by injecting drugs in the blood vessel in order to kill the cancer cells that could be anywhere in the body.
The intensive treatment for breast cancer usually takes about 6 months, but a person continues with the treatment up to 5 years before one is being declared cancer-free. Doctors recommend that a person should seek medical attention as soon as they notice symptoms. Breast cancer is the most common cancer in women worldwide and is also the leading cause of cancer-related death in females. However, there is evidence to suggest that advocacy and education can play a critical role in reducing the prevalence. Dennis Wonyala, Urban TV.